today during our presentation. So, who am I? My name is Dr. Michael Lee. I'm the founder of Crossroads Brain and Spine. Thus far in my career, last year I was voted a top 5 decompression doctor in the United States. I was voted the top doc within Disc Centers of America, which is the biggest group of disc specialists across the United States. I have a national certification in spinal decompression. I'm a certified sleep specialist, and I co-authored a textbook on some of the technology that I use in my office. So, a lot of people are probably wondering why. Why are we here? Why are we here during lunch? Why are we talking about this? When Marisol reached out to me, she said there's an inordinate amount of people in our company that are having back surgeries, neck surgeries, and knee surgeries. And it's obviously very costly for you as the person, and obviously very costly for the company as well, for you to be off work from a back surgery or a neck surgery. So she wanted me to cover what causes back or neck pain. What are some things that we can do to prevent this? What are some treatment options? What are the success rate of those treatment options? When should you be contacting a doctor about the pain? And what are the most common types of surgery and the costs associated with those types of surgeries? So as we go forward, I don't know if this is for you. Maybe this doesn't apply to you, but maybe it applies to somebody that you know, because statistically speaking, low back pain affects 80% of Americans every single year. It's the most common disability for people under 45. And when I asked her the demographics of who would be in the room, she said most people in the room kind of fit this age range, but we also have a lot of people that are over that 45 mark that are dealing with back and neck pain. And it's affecting not only your job, but it's also affecting your life at home. 1 million Americans undergo back surgery every single year, and low back pain, just as a single diagnosis, costs us more than $100 billion a year. $100 billion just on one single diagnosis. And the reality is that this problem is getting worse. In fact, in America, the rate of spine surgery is 5 times more likely than it is in the United Kingdom. A lot of times when people have a surgery, they say, oh, once I have that, I'm good, I'm covered, I'm going to be set forever, I won't have to have another surgery. Well, the New Yorker did some digging and they found out that 72% of people that needed a back surgery needed a second one. And that's what we call adjacent disc syndrome. If you have to have a fusion, given enough period of time, you're going to have a fusion at the level above. So when people have spine surgery, they're not just having one, they're having multiple over time. What I try to do with my patients is figure out why. Why is that? Why are those discs starting to break down? Why is the spine starting to break down? What's the degenerative process that's causing that? And 75 to 80% of specialists within healthcare believe that spine pain originates from the disc. Now I want to ask, how many people in the room have been to a chiropractor before? So over 50% of the room. Chiropractic works great. Chiropractic traditionally is worried about adjusting the joints of your spine. A joint problem and a disc problem are different. If 75 to 80% of spine pain is coming from the disc, going to a regular chiropractor and getting spinal adjustments are not going to help the problem, because it's not coming from a joint, it's coming from a disc. That's where I specialize, and I specialize in focusing on the disc. So a lot of patients ask me, what causes the disc to break down? Well, there's really several categories of what causes it. Stress. Stress is the umbrella. Once we talk about stress, we talk about physical stress. It could be the degenerative process, it could be the aging process, it could be car accidents or sports injuries. Raise your hand if you sit behind a desk for 8 hours a day. Right? When I talked to Marisol on the phone, she said, yeah, a lot of our people sit throughout the day. We have standing desks, but most people sit throughout the day. And I'll talk about why sitting is the new smoking. Sitting is the #1 risk factor for spine pain, because it's putting more pressure on those discs, which 75 to 80% of the time, spine pain is coming from those discs. The disc is super important because it acts like a shock absorber. Every time we walk or gravity is acting on our spine, from the second we wake up to the second we go to sleep, those discs are absorbing pressure from gravity pushing down. These discs are allowing for movement, and they're acting as a spacer for those vertebrae, because there's nerves that are exiting the spine through these holes. So as your discs start to break down over time, those nerves can get pinched. Raise your hand if you've heard of anybody having a pinched nerve in their back. Pinched nerve is not coming from a joint. A pinched nerve is coming from the disc. I think about the disc a lot like I think about a tire. When you have a healthy, normal tire, the tread is good, the air in the tires is normal. But as that tire starts to wear down, the tread on that tire starts to get less and less. You can drive your car with a tire that's starting to go bald, but you can only drive that tire for so long until that tire gets worse and worse and worse, and you can start to have other effects. Fixing a tire is a relatively cheap thing that you can do. You can go to Costco and buy a new set of tires. But if you keep driving that tire that's bald, sooner or later the metal is going to show through. Same thing with the disc. Discs can start to bulge. Bulging disc, people live with bulging disc every single day, but a bulging disc left untreated becomes a herniated disc. As we let these problems get worse and worse and worse, just like the tire analogy, your spine gets worse and worse and worse, and then there might be a time where there's nothing on a conservative side that we can do. You have to have a surgery. So we want to prevent those discs from blowing just like the tire. So we talked about how spinal surgery is 5 times more likely. From 2000 to 2012, spinal fusion surgeries in the United States increased by a significant amount. Does anybody have a guess what the percentage increase from 2000 to 2012 in spinal fusions? Throw it out. 150? 75? About 700%. 700%. Why? That's because these discs, all disc injuries have a similarity. Disc injuries have lost their innate ability to stay healthy and hydrated. Just like the tire in your car, over time, as it starts to bald, will lose its ability to keep that air inside of the tire. Your discs will start to lose the ability to keep the water inside the disc, and that's where we see a failure of these natural mechanisms that keep those discs healthy. So like I said, gravity is always pushing down on those discs, and those discs are trying to resist the gravitational forces. Now, unless we live on the moon, we cannot get away from gravity. The second we go upright, gravity is pushing down on our spine. So I asked about sitting. When we're standing, there's 100% of gravitational push down on our discs, right? That's normal. Our body can resist those forces. When we sit, we start to see that percentage go up. When we're sitting down and in a forward flex type of posture, like if we're working at a desk, that pressure can increase by 190%. So now what's happening is the discs are taking 190% more of that force when we sit. Now, sitting isn't inherently bad. Standing isn't inherently bad, but it's when we sit for extended periods of time, now we're putting that excess pressure on the disc that causes them to wear down faster. So our current medical approach is I have back pain, I go to the doctor, and the doctor gives me painkillers. Pretty simple. We all know about the opioid crisis, but the problem with opioids is that they work. You take this pill and I don't feel any pain. It's not fixing the underlying problem, but opioids work. The next step is getting an epidural injection. So raise your hand if you know anybody that has had an epidural injection. Interestingly enough, the epidural injections are not cleared by the FDA for spine pain. Epidural injections were originally designed for people on hospice care, but we realized that epidural injections can help numb the pain. They're not fixing the underlying cause, but they're numbing the pain. If epidural injections don't work, then you find yourself on the operating table and have a fusion or any other type of surgery. So if opioids, injections, and surgeries are the current approach to spine pain, we should probably be slowing down. So my question is, are these drugs, injections, and surgeries, are they fixing the root cause, or are they masking a symptom? They're masking the symptom. I want to figure out how we get to fix the underlying problems, right? Most people that come to see me, they want to avoid the addictive drugs, they want to avoid the risky injections, and most people don't want invasive spine surgeries. And I love when surgeons say, oh, this is minimally invasive. A minimally invasive surgery is some type of surgery that you don't have. A surgery, they're cutting pieces of you out. So I want to ask you, all this that we've set up until this point, how would you feel if I could show you a path that doesn't require addictive drugs, risky epidural injections, and invasive spine surgeries? Would you be open to that? Sharon is one of my hallmark patients. Sharon had an anterior neck fusion. So she went in, same type of scenario. She had the drugs, she had the injections, and sooner or later they fused her neck. Keep in mind, she was a nurse, so she knows how these things work. So she decided to have the surgery because she thought that surgery was the only answer. About 4 months goes by, she's under my treatment, and she said, my only regret is that I didn't visit him before I had the surgery. Sharon, her spinal fusion did not work for her. Malika is another one of my hallmark patients. She was 10 out of 10 pain. She was unable to stand or walk for very long, couldn't clean the house, cook much. She got her life back without a surgery. She was heading towards surgery, and I was the last stop before she saw the surgeon. Patients that usually come to see me before they go under the knife. So I always ask my patients, imagine what your life could be like if you could get back to the activities that matter most. I've had grandmas in my office that say, hey, I just want to be able to hold my grandson. Today I had a patient from Terre Haute drive 2 hours one way to see me, and he said, I just want to be able to walk to the mailbox. 2 hours one way to see me, I just want to walk to the mailbox. So imagine what your life could be like if you could do the things that you wanted to and not be stricken by spine pain. Would it be worth your time if you could get your life back without drugs, injections, and surgeries? Yes. Would it be worth your money? That's what we got to answer. So when would be a good time to see a doctor? And most people, just like with the tire analogy, they wait until it's too late. They wait until the metal is starting to show through, and there's not much we can do for you at that point in time. Pain is usually the last thing to show up. This degenerative process can be decades in the making, and it's usually the last thing to show up is pain. So most people wait until they have pain to go to the doctor and see what's going on. Some people wait until their foot starts to drop. Raise your hand if you've ever heard about foot drop, right? When you're walking, a couple people have heard about foot drop. If your foot starts to drop or your leg starts to drag and the muscle starts to waste within your leg, then we know that there's a neurological problem. If these neurological problems continue, you can start to lose strength and you can start to lose control of your bowel or bladder. That's not a great day. And I've seen and I've known a lot of surgeons that said, oh, just wait until you use the bathroom on yourself when you're not intending to. If you wait till that point, then it's time for a surgery. Why should we wait until the point that we can't control our bowel or bladder? Most surgeons, that's what they say. So how many of you have been told or know people that have had low back pain or have had neck pain, have had radiating pain down their arms or their legs, have had tingling in their hands or their feet? They've had weakness or numbness in their hands, or they're unable to stand or walk for long periods of time. If you're like me, I'm thinking about people in my family that this pertains to, right? How many people have been told or know somebody that's been told that you have a disc herniation, or you have a disc bulge, or you have sciatica, or degenerative disc disease, or spinal canal stenosis? We go to the doctor and they throw out these terms, and then you're slapped with this diagnosis of, hey, I have a herniated disc, but I don't know what to do about it. How many of these people that we're thinking about have been told, like Sharon, surgery is your only answer? Well, I'm here to tell you today that it's not. How many people have had an MRI or an X-ray of your spine or know somebody that have had? Okay? How many people have tried chiropractic or acupuncture or physical therapy or cortisone injections or an epidural injection or even had a surgery on your spine? Is there anybody in the room that has had a surgery on their spine? Okay, great. We're beating the odds. How many people have known somebody that has had a surgery on their spine? And just throw it out there, are they better or worse after surgery? Worse. Five surgeries. 5 fusions. So what do we know about spine surgery? We know that statistically speaking, upwards of 50% of spine surgeries are unsuccessful. They do not work. Last fall, I got certified in decompression research, and we had a neurosurgeon that was speaking to us, and he said, "What's the success rate of a surgery?" And of course, I didn't know. And a surgeon will gauge a success rate of a surgery by a 30% reduction of symptoms. 30% is deemed successful. So we know that upwards of 50% don't work. The 50% that do work, there's a 30% reduction of symptoms, and 72% of the time these people need another one, and another one, and another one, and another one, 5. So as I see it, there's really 2 types of people. There's people that say, well, that's just how it's always been done. I go to the doctor, I get my drugs, I get my injections, I get my surgeries. Or there's people that say there has to be a better way. And I'm just going to throw it out there. I think that probably you are the people that say it has to be a better way because you're here. I'm sure Marisol said, hey, there's a doctor coming in to talk about spine pain. If spine pain wasn't of interest to you, you probably wouldn't be here. So if you're like these people, you know that there has to be a better way. This is William. William came to me because I was his last resort before going under the knife. And if you're like these people, you won't be disappointed with this type of treatment that we do in our office. And as you can see, I have people that are young, I have people that are old, I have people that are tall, I have people that are short, I have people that are skinny, I have people that are heavy. I've taken care of people from 18 different countries that all live in Indianapolis. And interestingly enough, black, white, Hispanic, doesn't matter, tall, short, heavy, thin. Spine pain affects us all about the same percentage. There's really no prevalence of demographics that we can say causes spine pain more than the others. So these are some of the people that have come into my office and have been saved from not having a surgery. Come on, clicker. I have so many people, it's slowing down. This patient, this is Autumn. Autumn comes to me from Kokomo. She drives to Kokomo 3 days a week. She was feeling numbness and burning in her thumb and her pinky finger, and she said, I don't know what to do. They said I have to have a fusion, and I don't know what to do. So Autumn comes to me from Kokomo to fix the herniated discs within her neck, which is pretty cool because a lot of people have been told that if you have had a herniated disc, there's really no treatment for it, right? Or if you have a disc bulge, oh, a disc bulge, it's not that important. Disc bulges left untreated become disc herniations. Disc herniations left untreated, they only get worse. I think about spine pain a lot like I think about the aging process. Raise your hand if your hair has started to go gray. Or maybe not raise your hand, right? If your hair starts to go gray, does it just spontaneously stop going gray and go back? No, it keeps going down the process. So when I hear surgeons say, oh, a disc bulge, it's going to heal itself on its own. Within 8 to 12 weeks, statistically speaking, a disc bulge can spontaneously heal. But if we go past that 8 to 12 weeks, then we know that that disc bulge is going to degenerate into a herniated disc. And a herniated disc is then going to degenerate into a sequestered disc. So these things, they don't just spontaneously heal on their own based off the statistics. So we've talked about a lot. Usually by the time I get to this point, people have 3 main questions. Number 1, how does this work? Number 2, how long is this going to take? And probably the most important, how much is this going to cost? Well, the exciting news is that I can help. I can help you like I've helped all the other patients in my office. Just today I did the math, I've done 4,854 decompression treatments in my office. So if I can help 4,800 people, why can't I help you or someone that you know? So how does this work? These are my top 3 secrets to avoid spine surgery. Number 1 is called digital infrared paraspinal thermography. What the heck is that? This is the technology that I wrote the book on. I spent the first 2 years of my practice writing a textbook to train other doctors across the globe how to use this technology. What this technology does is it allows me to take an infrared reading of your spine. Temperature and inflammation work hand in hand, right? Like if we wake up and we don't feel good, we have a temperature temperature and inflammation, temperature and disease work hand in hand. Well, we have a non-invasive approach that we can measure the temperature within your spine to see if there is a problem, which is pretty cool. And there it is. My mom wanted me to put that up. So the second thing I do with my patients is a class 4 laser therapy. What the heck is class 4 laser therapy? This is the strongest non-surgical laser available to us on the market. Basically what we're doing is we're using this technology to change the physiologic function of the cells and tissues that may be damaged in the first place. Without bothering you with all the physiology, it's a magnet to blood. In the second decade of life, discs, the blood supply starts to retract. We don't know why, but we know that in the second decade of life, we start to lose blood supply within our discs. So when discs start to bulge or herniate, or there's a tear, discs have a very difficult time healing because there's no blood. If you cut your skin, it starts to scab. That's the healing process. Your discs cannot scab because there's no blood. With the laser, we bring more blood flow and we bring more healing to the site of the damage. The great thing is it's cleared by the FDA. The third and most important thing is non-surgical spinal decompression. So this is called the DRX 9000. Last time I checked with the manufacturer, I'm the only doctor in the state of Indiana that can do non-surgical spinal decompression for the low back and the neck. The cool thing is that I have 2 of these in my office. When I started my office in June of 2022, I said I'm going all in. I want the very best technology because if it's my mom that has a herniated disc, I want the best for her. I want it cleared by the FDA and I want the Ferrari. I don't want to go Honda. So I went all out and I have the very best technology that the market has to offer for us. And here are some of my patients that are on the DRX 9000. Most recently, I contributed to the authority of non-surgical spinal decompression, which was a book specifically about the discs. My mom really wanted me to put that on as well. So there you go, Mom. When we look at the non-surgical spinal decompression, it's all about helping those discs rehydrate. If your tire on your car starts to lose air, the only way that you can fix that air is to put more air in the tire. Agree? Now we could go and we could do massage on the tire and we could do acupuncture on the tire and we can kind of kick the tire and maybe push on it, but it's not going to help put the air back in the tire, right? Same thing with the disc. The disc is made up of 86% water. Non-surgical spinal decompression helps put water back in the discs so the disc can heal naturally without drugs, injections, and surgeries. That's the name of the game. How long does this take? Well, the lead disc method, as I said, I did the math today. I had to send Marisol the presentation a little while ago, but today I've done over 4,800 treatments in my office. Most often, patients that come to see me, that 90 to 120 days seems to be the sweet spot. Now, some patients need a little less, some patients need a little more. But if I can't help you in that 3 to 4 month range, then okay, maybe you are a candidate for surgery. Maybe you are a candidate for an epidural injection or a fusion. But typically on average, my success rate is 90% with my patients that I have 90 to 120 days. Because these disc injuries, they're degenerative in nature, right? I'm good at what I do, but I'm not God. I can't fix it in one to 2 treatments. These processes, they take time. And when we talk about the success, the McClure study is the biggest non-surgical spinal decompression study that we have to date. Dr. McClure is not a chiropractor. Dr. McClure is an orthopedic surgeon. He had 500 pre-surgical candidates that all had MRIs confirming they had a disc pathology. He had a success rate of 88 to 92%. Patients reported a 50% reduction of symptoms. So by doing non-surgical spinal decompression, we know that we're almost double the success rate that of a surgery, and we're not cutting anything out of your body. I don't know about you, but that sounds pretty attractive to me if it's my mom that is dealing with a herniated disc. So the third question is, how much does this cost, right? The answer is everybody's different. But most everybody in the room has insurance, right? I mean, insurance is a kind of a necessity. Interestingly enough, in 2024, Health Breakthroughs magazine, this was a patient that had had a fusion. She had a lumbar fusion in L4, L5. She came to me, she brought this magazine and she said, "Hey doc, I think you would find this kind of an interesting statistic. In 2024, your insurance company would pay $111,000 for a spinal fusion." That's a lot of money. That's a lot of money. Now you don't have to answer, but think about your deductible. Think about whatever your deductible is, and think about your out-of-pocket. Your insurance company will pay for some of your spinal fusion, but it's not going to pay 100%. Not going to pay 100% at all. And when you start thinking about the percentages of a surgery that costs that much money, we're talking some serious change that you got to throw on the table for a 30% reduction of symptoms 50% of the time. What patients don't think about is they don't think about the cost for their prescription medications. Your insurance may not cover 100% of those costs. Physical therapy has a copay. Hospital fees, lost wages, time off work, and post-surgical complications. A lot of people think about just the dollar amount of how much this operation actually costs, but I've had patients that have had surgery and said, "Oh my gosh, when I count up all of these categories, I'm in the tens of thousands of dollars that I've been personally responsible for outside of what my insurance covers." So those are the extrinsic costs. The intrinsic costs are getting back to the activities that matter most. My wife is an occupational therapist, and occupational therapy is all about helping patients get back to something that matters most to them. Maybe it's picking up your grandkids. Maybe it's just playing with your kids. Maybe it's like Larry, who drives 2 hours from Terre Haute to just walk to his mailbox. We all have intrinsic things that we want to get back to. When we look at the medical management of spine pain, this study was done and they found that a discectomy costs 19 grand. A spinal fusion costs 60 grand and a laminectomy costs $85,000. What most people don't understand is that when you have a fusion, you have to have a laminectomy. A laminectomy, they start cutting things out of your spine in order to put the screws in. So a lot of times people say, "Oh, I only had a fusion, I didn't have this." But then when I read their MRI report, it's like, "Oh yeah, they cut things out of my body." Wait a minute, my surgeon never said they cut things out of my body. And yet here we are with an MRI that says they cut out some of your anatomy and we have screws put in the spine. So a lot of times people have one surgery, but they have two procedures in that one surgery. So when we break it down, the cost of a discectomy, if your copay is 20%, you're paying $3,800 just right off the word go for a discectomy. If you have a fusion at 20%, you're paying $12,000. If you have a laminectomy, you're paying 17 grand. Now, I don't know about you, but my mom doesn't have 12 grand just sitting around to throw away for a surgery that's going to work 50% of the time and it's only going to help her 30%, right? But there's always a balance, right? We always want to balance our health with our money. A lot of people say my insurance is going to cover 100% of it, and just the reality is that a lot of times people get buried in medical debt because they have had low back pain. They have had neck pain. They've had radiating pain going down their arms or their legs. They have numbness, burning, or tingling. They have weakness in their upper arms or their legs. They're unable to stand for periods of time, and people just don't know what non-surgical, non-invasive, non-drug related options are for them. So I don't know if this is my dad, by the way. My dad lives 3 hours away, up in northern Indiana. And my dad said, I want to get on that table. I want to see what that's like. And I said, "Dad, you don't have a bulging or a herniated disc in your neck." He said, "I don't care. I want to just see what it's like." So I was able to take his x-rays, and I said, "Yeah, Dad, there's some disc compression going on." And he said, "Well, how much is this going to cost?" And I said, just put it on my tab, reverse my tab that I've had up until this point. So all this to say, if this is safe enough for my dad, it's probably safe enough for you as well. So raise your hand, again, if you've been told or someone that you know has had a disc herniation, disc bulge, sciatica, degenerative disc disease, spinal canal stenosis. You or that person may be a candidate for this type of treatment if that has been something that you've been told. Tawana, she was in my office this morning. She's a bus driver. She said, I've been a bus driver for over 30 years and all I want to do is help kids get to school safe, and I can't do this because I have a herniated disc in my back. Tawana's been under my treatment for, Reagan, what would you say, six weeks? And now she says, hey, I don't have to worry about driving the kids to school anymore. Tawana just wants to drive a bus. Interestingly enough, Tawana was in a rough spot when she came to me. About a month went by and she came in and she was really happy. And I said, Tawana, what are you so happy about? And she said, I painted my garage this weekend. I said, Tawana, a month ago it was difficult for you to drive a bus. Now you're painting your garage. And she said, yeah. And I said, if you really want to paint a garage, you let me know, because you're more than welcome to come over and paint my garage. Raise your hand if you've tried PRP injections, or you know somebody that has had PRP injections, or stem cell injections, or other types of injections to their spine. Insurance doesn't cover PRP injections. Insurance doesn't cover stem cell injections, and some corticosteroid injections is not covered. But the fact of the matter is, patients that have had pain, they try chiropractic, they try acupuncture, PT, cortisone, PRP, stem cell, epidural, spinal cord injections, nerve ablation. Raise your hand if you know somebody that has a nerve ablation where they burn the nerves. How did that work out for them? Burning the nerves. Okay, you knew somebody that had how'd that work? He didn't feel good. Yeah, a nerve ablation, they go in and they burn the nerve. They literally burn a nerve. What they don't tell you is that within a year, those nerves can grow back. So now every year we got to go in and have the same type of procedure done. So if you or someone that you know answered yes to any of these questions, bulging disc, herniated disc, sciatica, stenosis, numbness, burning, tingling going down their leg, they may be a candidate for this type of treatment. Part of my process is I have to determine, are you a candidate or are you not? Maybe we have an MRI. Maybe we take an x-ray and see exactly what's going on, because this type of technology is very sophisticated. There's a lot of math and there's a lot of physics that I have to do in order to determine how much treatment we actually need. Because this is not a cookie cutter thing. Every body is different, but every person is also different. So part of my process is determining, number one, are you a candidate for this type of treatment? Is there a reasonable likelihood that I can help you? And I tell all my patients that I don't take anybody that I don't think I can help, because I don't think that's an ethical way to go about it. And I talk to my friends that are surgeons, and they say, oh yeah, I'll operate on as many people as I can. And on my side of things, I only want to help people that I think I can help. Because if you're my mom, I don't want you to go see a doctor that is taking a chance on you. So part of my process is figuring out, can I help you? And if I can't help you, then let me put you in the right position. If I can help you, then okay, how much treatment is this going to take? How much money is this going to cost? And how much time is it going to take? The answer is, I don't know, right? So when I think about trying to determine somebody's candidacy for care, a lot of people have had an MRI. MRIs don't always show us 100% of what's going on with the disc. People think the MRI is the end-all be-all. I can tell you it's not. A lot of times what I have to do is I have to take an x-ray. When I take an x-ray of somebody, I can mathematically measure how compressed those discs are. Once I can measure it, now I can manage it. Because nobody gets an MRI before a treatment and nobody gets an MRI after a treatment. Because an MRI, even if your insurance covers it, your out-of-pocket cost is somewhere between $500 to $1,500. So now we're talking $3,000 in just MRIs. We don't want to spend $3,000 on a diagnostic test. I'd rather spend that money toward a treatment that actually works. So my gift to you for my relationship with Merchants Bank is I am offering a no obligation consultation. Now, some of you may have seen my social media ads, or they may have seen me on Google. I offer a no obligation consultation to any patient that walks in my office, because I want to see if I can help you. And if I can't help you, then I'm going to tell you straight up, hey, I think you're better off having a fusion. So my no obligation consultation is already out there. It's already on the table. However, I want to give you guys a bonus. I want to say thank you for coming and spending your lunch and listening to what we have to say. So normally my x-rays, full disclosure, my x-rays are $325. I take a three-dimensional set of x-rays that nobody else takes. Nobody else takes that I've seen. People say, I've had an x-ray at another chiropractor, or I've been to the medical doctor. Nobody takes the x-rays that I need because nobody is as specialized as I am in treating the disc. So normally my x-rays are $325. I don't typically do this. However, due to the relationship that I have with Merchants Bake, $225, I will take your x-rays, I'll do your consultation, I'll knock $100 off. So it's only gonna cost you $225 for you or someone that you know to see if I can help. For $225, would it be worth it to say I can avoid addictive drugs, risky injections, and invasive spine surgeries? If it's my mom, and I want to set the precedent. I talk about my mom a lot because my mom, she struggled a lot in her life. She had this congenital abnormality of her spine, and she was under a chiropractic care for two decades. 2 decades she was under chiropractic care, and it never really worked, but she thought, well, maybe if I just keep going and I keep going and I keep going, it will work. 2 decades goes by, nothing is working. I go to school and I start learning about the spine. Well, what I'm not telling you is that my mom was dealing with this debilitating neck pain. So much so that she started to medicate at home. She didn't want addictive opioids, she didn't want injections, she didn't want a surgery. Because the surgeon said you're more likely to die on the table than you are just dealing with what you're dealing with. So she said, well, I'm not gonna go to surgery, but I don't want injections and I don't want to get addicted to drugs. So my mom started to medicate at home. And she started to medicate at home, and her medication turned into an addiction. My mom was an alcoholic, to the point that it started to rip her family from her. Because if we know how much alcoholism affects our family, it's a big deal. So her alcoholism started to rip our family apart because she just didn't want to deal with the neck pain. Soon she had to quit her job. Soon she retired. When I started to learn about the spine and when I started to specialize with the spine, I said, hey Mom, I think I can help you. So she drove 7 hours one way from northern Indiana to St. Louis to come and see the doctor that I was training with. And she sent me a text, I'll never forget this text. She said, thank you for introducing me to what you do, because I no longer have to drink because of the pain. Seemingly overnight, my mom was no longer an alcoholic because she no longer had pain in her neck. My mom passed away Thanksgiving weekend of 2021. I opened my practice in June of 2022. My mom never got non-surgical spinal decompression. But I thought, and I think, if I could have met my mom 20-something years ago, if this technology would have been available for my mom 20-something years ago, how much pain could she have avoided? Would my family not have been ripped apart if I could have helped my mom 20-something years ago with this type of treatment? So anytime that I talk to the patients or anytime I give this type of presentation, I'm talking to my mom, because maybe there's somebody that you know, or maybe it's you that is dealing with this problem. And I'm going to tell you that I'm good at what I do, but I'm not God. Everything in medicine, we all base it off of statistics. But I can tell you, I've done over 4,800 treatments in my office and I have a 90% success rate. If I don't think I can help you, I'm going to tell you, because I don't want you to end up like my mom. So that offer is on the table for you or somebody that you know. By the end of June, because we're heading into Memorial Day weekend, you got a month. I can't offer this forever because my practice is very busy. I can set aside appointment time, so that offer is for you or somebody that you know until the end of June. Does that sound fair? Now, I think we got a few minutes left. Does anybody have any questions? Obviously HIPAA, and you don't have to share, but does anybody have any questions about something that we talked about? That's a fantastic question. About 25% of my patients all have had a prior surgery. If that's a discectomy, if that's a fusion, if that's a laminectomy, about 25% of my patients have had a surgery. And when I sit down with them, I always call the surgeon. So whoever did the surgery, I always call the surgeon. I say, hey, this is what's going on. Do you have any problem with that at all? And I haven't had a single surgeon say no. And surgeons, I mean, they make money from doing surgery. And every surgeon I talk to say, hey, if you can help them without drugs and injections, great. So yes, that's a common question that I deal with, and about 25% of my patients are all post-surgical. You had a question? Oh yeah, sorry. That's a fantastic question. So what happens is when you look at a disc, right, you have a vertebra, in the center you have a disc, okay? Now the disc is made up of cartilage and it's made up of glycosaminoglycans, but it's predominantly made up of water, right? So what happens is you have a vertebra. As those vertebrae get compressed, it starts to put excess pressure on the disc. Water moves from an area of high concentration to an area of low concentration. This is biology 101, our freshman year of high school, right? So as those vertebrae are pushing down on that disc, it's actively pushing water out. What this treatment does, and this is the study that got cleared by the FDA in 2002, what we do is we very gently pull those vertebrae apart. We're decompressing the spine. As we're decompressing the spine, we're creating a negative pressure inside the disc space. That negative pressure is super important because we reverse that pressure gradient. This is why all these other treatments, they don't work, because they're not reversing that pressure gradient. As we're decompressing the spine, we can suck little drops of moisture, nutrients, hydration back into the disc. Now the question is, okay, if you decompress that disc, what's keeping that water inside of it, right? Just last week, real world example, drive a minivan, I'm a father of two, I ran over a nail. I kept filling up the tire and the air would go out. Well, that air, I can put the air in, the tire's not retaining that. I took it and I got it patched, now the air is fine. When discs are injured or they're herniated or they're bulging or there's a tear, those discs are not retaining that fluid very well. What the Class 4 laser does is we try to get that disc to seal. The decompression gets it to heal, the laser gets it to seal. Does that make sense? And there's a test at the end, so. Most of my, it's a non-invasive treatment, which is really nice. As Reagan would tell you, Reagan is my lead clinical assistant. She helps me get patients on and off. Most patients, what would you say the treatment feels like for them, Reagan? The biggest complaint that I have is that they snore. They're like, hey, do not let me snore. But yeah, the treatment feels very, very relaxing for them. Yeah. You had another question? That's a great question. I would ask you to use your standing desk that Marisol said that you have, right? When I was in school and I was studying for 12 hours a day getting ready for boards, right? 12 hours a day I was sitting on my butt. So I would sit for a little bit, 15, 20 minutes, then I'd stand. Then I'd sit on an exercise ball. Then I had a kneeling thing. Then I would put my computer at my dresser. So I would stand up and then I would sit. So sitting isn't inherently bad. We just don't want to be in that sustained position for a long period of time. But the goal with this type of treatment is that we're building the resiliency of the disc so that it retains the water, right? So you can sit for the rest of your life, but the goal is we want to get that disc to retain it. Does that make sense? There was another question? No? A typical treatment is 22 minutes and 45 seconds. Yeah. Earl, you had a question? That's a great question. The discs, we don't have any medical evidence to support that the disc will grow back. what we're seeing is that as those disc heights get compressed, we're not really losing tissue, we're losing water, right? So when you look at the structure of a disc, it's like a jelly donut. Inside the disc, you have that nuclear fluid, like the jelly of a donut. The outer layers, the outer cartilage rings, are the cartilage. You're really not losing the cartilage, you're just losing the water inside of it. So the goal is that we can make it thicker, but we're not regrowing the tissue. They are trying to do some of that with stem cells right now. The FDA is really, stem cells and the FDA, it's kind of a hot topic right now. So a lot of professional athletes are going down to Panama to get stem cell injections. Typically stem cell injections, at least from what I've seen in my practice, work better in joints than in discs, because if you stick a needle inside of a disc, you're now puncturing the disc, and there's not a great mechanism that they have to heal that. So stem cell injections in the spine is not 100% yet. Maybe one day it will be. Go ahead. What are the main causes of compression? It can be sustained postures at work, like sitting. It could be sports accidents, it could be a fall. At least 50% of my patients have what's called a non-trivial trauma. So they just said, oh, I just kind of started. That lets me know that it's probably more degenerative in nature, right? Like you don't wake up and your hair's completely gray, right? It starts kind of one at a time. So the forces, we're not 100% sure what causes that, but we know that there's some things that can speed up the degenerative process, and there's things that can slow the degenerative process down. Those can definitely help. The biggest study ever that was done, they had 10,000 MRI. They took 10,000 MRIs of asymptomatic people that did not have any type of pain at all, and they found that 52% of those people had a diagnosable disc pathology on an MRI. So, like a disc bulge. Disc bulges don't always cause pain. We can see that on an MRI, but we know that if it's a disc bulge on an MRI, that given a long enough period of time, that can break down. So, statistically speaking, in that study, 52% could have something. It just symptomatically it hasn't started yet. Does that make sense? Kind of like an iceberg. Like 90% of an iceberg's mass is under the surface, right? Sometimes disc bulges can resolve on their own, but if symptoms start to happen and pain starts to happen, then we know that it's probably a little more advanced. Does that answer your question? Give or take.
What's the average cost?
Give or take. Are we talking one disc? Are we talking two discs? Are we talking 3 discs? Is it a herniation? Is it a bulge? Is there post-surgical complications with that? I don't really know. It's not based off of time. It's based off of treatments, right? So like I have some patients, my Terre Haute patient, right? He says, hey, I can't drive 2 hours every day, right? So for him, I said, all right, you're gonna come to my office before lunch, and you're gonna come to my office after lunch to give your body a little bit of time. So when patients pay for treatment, they're not paying for the time; they're paying for the amount of treatment. Does that answer your question? It's not a clear-cut answer because it'd be very difficult to say without looking at the imaging.
Insurance typically doesn't cover it.
So insurance will cover some of the treatment options. It won't cover 100%. The non-surgical treatment or non-surgical spinal decompression is typically a non-covered service. The NFL, the NBA, and the Professional Bowling Association will cover those. If you're in a car accident, typically it covers that. And that's across the United States. So most insurance companies they follow what Medicare does. And the non-surgical spinal decompression is right now not covered by Medicare. And that's in California, Texas, or New York. I could be an MD, a DO, and a physical therapist, and that's just the reality of it. But I do offer payment plans for patients because, some patients need, 120 days of treatment, 30, 40 visits. Some patients only need 20, but I create a plan custom for them. Does that answer your question? As good as I can without looking at an MRI. Okay. Is there any other questions? I know we're getting a little short on time. Cool. Well, I think I have a few minutes, so I will stay. If you have more specific questions, then you're more than welcome to ask. Everybody sat at a place that has my card. The best way to take advantage of a no obligation consultation would be to call my office. They'll put you priority on my schedule. Like I said, the X-ray offer, that's for you until the end of June. I also gave you a back surgery book. I helped contribute to this. There's the small blue one is talking about the costs of the back surgery, and then this vertical book is talking more about what we discussed, how to avoid back surgery. And in the front cover, you'll see why I do what I do, and you'll see a picture of my mom kissing me when I got my white coat. Cool. Well, thank you so much for your time, and I hope this was of value to you.